Let's talk about recovery after a knee replacement. I like to think of it as a partnership, a team effort between myself and you, the patient. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacements. The surgery itself is only 10% of the knee replacement process. 90% of a successful outcome is down to you, the patient, putting in the work as part of your rehab. We've answered a lot of your questions about getting a knee replacement, but I'd like to share some of the common questions I receive in clinic. What do I do if my wound starts bleeding? Well, don't be worried. Most wounds bleed a little bit, especially for the first 2 or 3 days. I recommend you cover the wound tightly with a fresh dressing. Your hospital will often send you home with some dressings. Otherwise, you can ask for a loved one to go to the local drugstore or pharmacy and pick up some simple gauze and white adhesive or sticky dressings, and that's probably all you'll need. If the bleeding continues to go on for too long, I recommend contacting your surgeon's office. They may need you to stop the blood thinner for a little while. If the bleeding is worrisome and it's after hours for their office, you must make a decision. If you're worried enough, you may decide to go to the local emergency department, or you can use a pressure dressing like the one we just said. What do I do if I can't control my pain? This is a simple fix. Take more painkillers, as long as you haven't gone over the recommended dosage. If you haven't had any of your prescribed opiates, and those are the morphine type meds, because maybe you're worried about them, then try a small dose. You can keep increasing the dose as long as, again, it's within the recommended prescription. Of course, you're right to try and get off those opiates as soon as possible. You can safely take Tylenol, acetaminophen, or paracetamol with most opiates, and they will work together, helping each other. And most of you will be able to take anti-inflammatories like ibuprofen, Advil, or Celebrex. But once again, please check with your physician. If you're still struggling with pain, even though you've upped your meds to a safe level, don't go beyond that point. At this point, you should contact your surgeon's office or even your family doctor. What will recovery and activity look like? Well, this is different for everyone. Don't fall into the trap of competing against someone else. This is your journey. It will take you as long as it takes you. But this is the rough timeline that I tell my patients. For the first 4 weeks, you may not like me. In fact, for about 4 to 6 weeks, you may regret having the operation. The knee will be swollen and sore during the stage, and the rehab work is hard and painful. But usually, by 3 months, most patients are already walking well and are better than they were before surgery. But please, above all, listen to this. You must work the hardest during the first month. Pushing through from day one, despite the pain you're feeling, is essential. Working with your therapist is really important, but doing the exercises you've been shown is even more important. You need to keep walking, bending, and straightening every single day, as many times a day as you can, aiming to bend your knee to 90 degrees within 3 weeks. On the days when you're exhausted and you don't feel like doing anything, that's the day to push even harder. We surgeons, we get it. It's a sore operation to recover from, but if you don't push your recovery, you can end up with a poor outcome. That can be a stiff and painful knee. The more you put in, the better your knee will function. Even once you've got a solid bend in your knee, you may still have an ache. You may have some clicking, and the knee may still be swollen. And that may last several months. But again, don't worry. This is normal. When can I drive? Well, there's no universal answer to this, I'm afraid. It varies from practice to practice and from surgeon to surgeon, so it's important to speak to your surgeon. One thing is true, you must feel safe enough to drive and to do what's called an emergency brake. That means slamming on the brakes on a moment's warning if a child, for example, runs out in front of you. If you have pain, or you're taking painkillers, or your reaction speed is delayed, then do not drive yet. It's important to be honest with yourself. Your reaction speed decreases after a joint replacement in the early recovery period, and if you're not quite ready, you can cause harm to yourself or other road users. I typically let my patients drive after 3 to 4 weeks, as long as they meet the health criteria mentioned before. You need to consider if you have an automatic or a manual, if it's your left leg or your right leg that was operated on. Another important thing to consider is your insurance. You must check in with your insurer to confirm their policy. When can I fly? Flying can potentially increase the risk of developing blood clots, the DVT and PE we talked about. And you're already at risk of blood clots from surgery, so combining the two can potentially increase the risks even more. I typically recommend patients avoid flying short haul, that means less than 3-hour flight, for a couple of weeks, and avoid long haul, longer than 3 hours, for a total of 6 weeks. Although there isn't much research behind this and the evidence is scarce. In fact, the only paper that talks about increased risk of blood clots found that there was no increase of blood clots after flying after a knee replacement. But I just want you to be aware of the potential risks and make sure you're taking your recommended blood thinner while you fly and for a couple of days after if you've already finished your course. Again, it's also essential to check your insurance. When can I return to work? Well, this again very much depends about what kind of work you do and how quickly you want to return to work. If you have a desk-based job, you can start work almost straight away. Most of the patients start within a day or two. Some extreme folks are working on the evening of their operations. Obviously, they're working from home. If you want to go to the office, the limiting factor is getting to and from work. So if you can get a ride, then you can go back to work at the office whenever you want. Follow the advice we provided about driving yourself. If your job involves manual labor, strange positions, standing, carrying things, or is in any way physical, I recommend you take about 6 weeks to normally 3 months before you go back. You must let your tissues repair. The replacements need time to bond into your bone. You need to let your wounds heal. Again, this decision is up to you, your surgeon, and your work. It's worth making an agreement before your surgery with work. But many of my patients want, and indeed need, to go back for a financial reason as early as 6 weeks. And I'm usually okay with this. But check with your surgeon. What will an infection look like? There are some obvious signs of infection you should watch out for, things like pus, redness, or a throbbing pain at the wound. But just to warn you, it's pretty normal to get some redness, some heat, and some swelling, especially with a knee replacement. So don't be overly alarmed. However, you should be concerned if the wound starts to come apart, if the discharge stops being clear or bloody and is more like a thick white or green discharge or pus, or if you start to see persistent temperatures and it's time to seek help. Please don't start antibiotics until your surgeon or physician has suggested you do so. Your surgeon will want to confirm the bug. PROMS. PROMS stands for Patient Reported Outcome Measures. When we do an operation, we want to see how well you're doing afterwards. And one way to find out is to ask you questions about your day-to-day activities, the level of your pain, and how you're feeling generally. Different surgeons have different questionnaires, but you'll fill out the same PROM questionnaires before and after the operation. I know it can be sometimes a bit of a pain to fill these in, but it really does help us know how you're doing. And it's good for patients because you get to find the good surgeons that get good PROMs after their knee replacements. How long will my knee replacement last? This question is really important, especially for you young patients out there. And I cannot answer that question accurately, but we can give you a guide. An excellent research paper was published in The Lancet, a well-respected medical journal. They followed up patients with knee replacements done over 25 years before and found that nearly 7 out of 10 knees were still in place 25 years later. That's pretty good. And technology has only gotten better since then. One thing you should consider is your knee replacement is like buying a luxury sports car. If you respect the car and you drive it carefully, that car is going to last for a long time. But if you drive like a reckless Formula One star, if you rev the engine and you slam the brakes on, then your parts will wear away quicker and need changing more often. Well, it's the same for your knee. Like, I never stop my patients from doing what they want to do. If they want to run or ski or play tennis, I tell them they should. Life is for living, and this operation restores your quality of life. But just like driving a fancy sports car, if you want it to last a long time, please move with care. Joint Recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.